Hello everyone. Today we are going to see about the local anesthetics, how it works on the human beings without affecting the consciousness. So let's go into. So exploring the pharmacology and mechanisms and clinical interventions that enable the pain-free procedures. So what is meant by local anesthetics? So local anesthetics are pharmaceutical agents that cause reversible loss of sensation in a specific body area without affecting the consciousness. So they work by blocking the nerve impulse conduction through inhibitions of voltage gated sodium channels. So these are the versatile drugs are administered topically or by injecting across multiple medical specialties, including dentistry, surgery, dermatology, and regional anesthesia procedures also. So by seeing the historical evolutions, it is actually generated from the cocaine leaves to the modern medicine also. So in 1884, the Carl pioneers the clinical uses of cocaine in ophthalmologic eye surgery that is used for the cornea. Actually, it is the one thing without we will be having without the blood vessels. So by 1860, Albert Niemann isolates the cocaine from the coca leaves, discovering the first local anesthesia compound. And in 1943 to 49, lidocaine developed and introduced to the clinical practice, revolving the anesthesia worldwide also. So by seeing the chemical classification, there are two groups. One is the ester versus amides. So all local anesthetics share three key components: an aromatic lipophilic ring, an intermediate chain, that is an ester or an amide linkage, and hydrophilic amine group. So this structure enables them to penetrate nerve membranes effectively. So by seeing the ester groups, cocaine, procaine, tetracaine, and benzocaine all comes under the ester groups, whereas the lidocaine, bupivacaine, mepivacaine, and ropivacaine are under the amide groups. So it is metabolized in the liver, whereas in ester groups it is metabolized by the plasma esterase. So there are high allergic reactions when compared to the amide groups. So the duration is also short, whereas amide group has a long duration and it is more stable actually. So how the local anesthesia works? So by diffusing the drug molecules diffuse across the nerve cell membrane in it to reach the intracellular receptors, whereas the channel blockade is bind to the voltage gated sodium channel, so blocking the sodium ion so that it influx into the cell. So whereas the signal interruption, so it prevents the action potential generations and propagation, so stopping the pain signals to the brain. So this is how the local anesthetics are working now. So what are the clinical uses and the techniques? So actually it is used for as a surface anesthesia, infiltration anesthesia, nerve block anesthesia, and spinal and epidural anesthesia. Topical anesthesia is also called as a surface anesthesia, whereas infiltration is directly injecting the localized thing into the nerve or tissues, so the numbness will happen in the small areas, whereas the nerve block anesthesia is it will blocks the major peripheral nerves or the nerve flexes for the regional procedures. So that is the axial block or some other blocks. And the epidural and spinal anesthesia is used for the cerebrospinal fluid or epidural field for the extensive regional numbness also. So about pharmacokinetics and the durations of actions, or lower and higher lipid solubilities leads to the faster action. So duration is by protein binding and the additions of vasoconstrictions like epinephrine. So it is hydrolyzed rapidly in the plasma, and amides metabolized more slowly in the liver. So what are the side effects and the safety considerations? CNS toxicity and cardiovascular effects and allergic reactions are more side effects. And by seeing the careful dose calculations and aspirations before the injections and continuous patient monitoring are essential for the patient safety. So what are the things we have understand? The vital role of anesthesias are the essential for modern medicine. Actually it is continuous into innovations, because it is a vast to learn about, and it has the clinical excellence also. I think you all have understood what is meant by local anesthetic. So how it is, what are the different kinds of local anesthesia we are using for patients for creating and pain-free surgery. So now there are recent advances and the notable agents also. So atrekin, its features are a unique thiophene ring structure combining the amide and the ester properties, whereas the rapid metabolisms and excellent tissue penetrations made it widely used in the dentist study. Whereas in ropivacaine, it is a long-acting drug, offers reduced cardiotoxicity compared to the bupivacaine. So it is providing safer regional anesthesia blocks that is used for the spinal also. And enhanced formulations, new delivery methods, and pH buffered solutions reduce the injection pain while improving onset time and the safety profiles also. So the vital role of anesthetics are essential for modern medicine, continuous innovations, clinical excellence. So local anesthetics enable pain-free sensations that across the countless medical and dental procedures, whereas the patient experiences the pain-free treatments for entities. And ongoing research and development involves both efficacy and the safety profiles with new agents and the deliberating systems, whereas it's emerging the regulatory also. So deep understanding of pharmacology mechanisms and the proper clinical applications ensures the optimal patient outcomes and the safe practices also. So I hope all have understand this local anesthetic as actually this is an introductions of the local anesthetics. We'll be seeing an elaborations of in the next topic. So thank you for watching.